Today I'm going to talk about inflammation and the foods that may or may not cause inflammation. And the reason I say may or may not is that people will react very, very differently to different foods. So it makes no sense to talk about foods causing reactions unless we first understand a little bit about what those inflammatory reactions are. Inflammation is exactly what it sounds like. It's a flame. It's something that's hot, red, swollen, and painful. And we need to understand it's an immune response, that it's your immune system getting into action for some reason. And this is something that's not happening to the body. It's not the food causing the inflammation, but it's something that's done by the body. It's the body responding. It's interpreting and reacting to that food. And this could be a local inflammation or it could be systemic, and we'll talk about both of those kinds. And number 10 on the list is dairy. A lot of people love dairy. It's a very popular food, especially if you're going low carb. You're reducing carbs to reduce inflammation from insulin resistance, but if you are sensitive to dairy, now you're just trading one type of inflammation for another, so it could backfire that way. So it all depends on if you are sensitive to that. Same thing with lectins and oxalates. There's a lot of talk about that. People ask me all the time, are lectins bad for you? Should I eat spinach because of all the oxalate? Well, it depends on if you have a sensitivity. And it's not that easy to figure this out. You can run some blood tests, but a lot of it is going to have to be trial and error. If everything is working, if you're getting healthier, then you're probably doing fine. But if you're still having some inflammation, if you have some aches and pains, if you hit plateaus in your weight loss, if you're having some issue, then you want to start thinking about these things. So what are lectins and oxalates? Well, they're plant defenses. Lectins are compounds produced by plants so they can defend themselves from getting eaten. And dairy, again, has a lectin called casein. We have a very popular group of plants, of vegetables, called nightshades. And while these foods are fantastic for most people, like tomato, potato, eggplant, bell pepper, and if you notice the dots, that means the list goes on and on and on. These are just examples. These foods could be fantastic for most people. But if you are sensitive to lectins, then the lectins create inflammation, then they're not good for you. Same thing with legumes. There's probably even more people that have trouble with them. Legumes have lectins in lentils, beans, peanuts, etc. And most grains, especially the popular ones, wheat, rice, and oats, also have lectins. So part of the reason that people get healthier when they cut this stuff out, especially the grains, is that they're reducing their carbohydrate load, they're reducing the insulin, but another part can be that they're also cutting out some lectins causing inflammation. Oxalates are another thing that can cause inflammation. They're mostly associated with the formation of stones, especially in the kidneys. So kidney stones can be some of the most excruciating back pain you have ever experienced. And spinach tops the list, but we have rhubarb, soy, beets, buckwheat, almonds, potatoes, and navy beans, and there's lots of other foods that have oxalates as well. Again, a lot of people will do just fine, but if you have a tendency to make stone, or if you're susceptible to these causing irritation, then they will cause inflammation as well in that person. And when I go over the foods, I'm going to talk about two basic categories of food. On the one hand, it's foods that are bad for certain individuals. Like in a crowd, there might be one person reacting very severely to peanuts or shrimp or something like that. And these are, of course, known as food allergies. And it could range anywhere from an anaphylactic shock, like some people could just smell peanuts and they could die if they didn't get treatment, Other people might have symptoms that could be acute or delayed. Some people eat a food and within 5 minutes they have a reaction, they feel bad. Other people would have a delayed reaction of 3, 4, 5 days, a delayed hypersensitivity reaction, and now it's very difficult to relate the symptom to the food that they ate. And there are tests that you can have, but they're kind of expensive, and there's just way too many things that they find. So it's always better just to kind of try to improve your overall digestion, I think, and the healthier you get, the better you'll be able to tolerate a lot of these things. Could also be that it's creating a little bit of inflammation, but that you're asymptomatic, and then you would never know, but it still sort of adds up over time. The bottom line, though, is that this, again, is not something that the food does to your body. It's an interpretation that your body makes about the food. And then there are foods that are basically universally bad. They're bad for everybody. And these would be foods that cause insulin resistance, because insulin resistance will increase inflammation in the body, a chronic low-grade inflammation. Foods that cause oxidative stress, that create reactive oxygen species and free radicals, they create inflammation. And it could be either that the food provokes that response in the body, or it could be that the food itself has been oxidized, so you're introducing a lot of oxidated material in the body. It could be that the oils have a very high omega-6 to 3 ratio. Ideally, historically, this should be about a 1-to-1, or maybe we can push it to about a 3 or a 4-to-1, but most diets today, if you're eating modern standard food, you're going to get about a 20-to-1 ratio, which is highly promoting inflammation. So these are foods that affect everyone to a degree, but again, there are differences. So one person could be extremely sensitive. Just one little bit will totally overwhelm their system, and someone else will still be affected, but it takes 50, 60 years before they get sick, and then they're still not as sick as the other person. The problem with these are also that they're not going to cause as strong a reaction. It's not like a food that you eat and 5 minutes later you know that something happened. These are more silent. It's a very low-grade chronic inflammation, and you're not really aware that it's going on, and that's why so many people have it and so many people are affected, because it's part of our lifestyle. It becomes chronic and it goes on year after year. But if inflammation is so bad, why does the body create it? Because it is a natural, necessary part of healing. And anytime you have a trauma or infection, the body goes through certain phases in response. So the acute phase is right when something happens, when you have some tissue damage or an acute infection, then the body goes to seal off that area. So it's just like the police at a crime scene. They fence off the area to protect that area, and that's exactly what the body does. First, it reduces the blood flow, so you'll stop the bleeding, and then as it stabilizes, it increases the swelling, and you have migration of white blood cells and increased circulation and metabolism, so you can bring more activity to that area so it gets all red and hot. And this should only last for hours to days, maybe 3 to 4 days at the most. Then the body should shift. It should be done with that part, and it should start healing. Proliferation means making new cells. So you break down the old cells, you make new cells, and that's how healing takes place. And this can go on depending on the size and the extent of the injury. Could go on for days or weeks or even months. Like if you break a bone, it could take 2-3 months to heal that. But then everything is kind of intact and together, and then the body goes into remodeling, and now it kind of smooths off the edges and cleans it up and tries to get it as close to 100% as it can. And this could go for weeks or even up to a year. And then we hope that after all that, the issue has been resolved, that we're back exactly like we were before the injury. And for the most part, if we have a small cut on the skin, then it will go back to 100%. But larger injuries, they rarely go all the way back. So they don't quite get resolved. Or if it's a systemic inflammation and it's because we keep reintroducing, it's part of our lifestyle, we keep putting in the things causing the inflammation, now the body also can't resolve it. So non-resolved inflammation is basically the cause of all our problems today. Chronic low-grade inflammation is associated with cardiovascular disease, with cancer, with dementia, and the list goes on and on. We can also have latent infections causing inflammation. When you get an infection, you fight it off, but you don't get rid of it 100%, just like 99%, and you still have some pathogens that go hide in the corners. They're just waiting for an opportunity. When you get a little bit stressed and your immune system goes down, now they pop up. And now you have infections that come and go, and it seems like you just never quite get rid of them, like Lyme's disease and Epstein-Barr and things like that. And also old chronic injuries where you injure something and there's a little residual inflammation. You don't quite get the full range of motion and the strength back in that body part. And of course you could have a combination of all of these. So you could have an old chronic injury that's made worse by a low-grade inflammation from food habits. But basically all disease that we're talking about is a result of inflammation that is not resolved. And when I say disease, I'm not talking about a cut on the finger. Your body heals that. That's just part of what the body can do. If you get a cold or you get a COVID infection or the flu, when you recover, your body has just done what it's supposed to do. That wasn't really a disease. Disease is when a trauma happens, when a challenge happens, and it lingers and your body can't quite get rid of it. That's disease. And virtually all of that is non-resolved inflammation. So the first foods mentioned here are bad for you if you're sensitive to them. People ask me, is dairy bad? Are lectins bad? Not for everybody. They're bad for you if you react to them, because then they cause inflammation. Some more foods that affect a lot of people, they're very, very common allergens, are soy, corn, wheat, gluten, and grains. So we're not just talking the wheat. With the gluten, we're talking rice and barley and rye and oats and so forth, because they affect people in different ways. Wheat is probably the worst, especially modern wheat, but a lot of people are sensitive to grains. And they cause immune reactions, but just like corn, they're also a grain, they're high in starch and sugar, so they will also affect insulin resistance. Number 5 on the list is alcohol. And alcohol, you don't really have an immune reaction to it per se, but it does absolutely affect insulin resistance, both because in many ways alcohol acts as a sugar, but also because alcohol is a tremendous burden on the liver. So together with fructose, alcohol is the factor that mostly creates a fatty liver and promotes insulin resistance. And then of course alcohol is also a form of toxin. It will create oxidative stress and reactive oxygen species. Number 4 is sugar. Sugar, of course, is 50% fructose, so that's almost as bad as alcohol on the liver. Then the glucose triggers insulin, so that promotes insulin resistance. And of course, we also have a tremendous amount of toxic effects and reactive oxygen species. The glucose can destroy blood vessels. It leaks out into tissues and causing swelling. So we can get a lot of tissue trauma also from sugar. Number 3 on the list is seed oil. And now we're getting into the really, really bad stuff when it comes to inflammation, because first of all, you can have an allergic reaction to it because they're made from things that are very common allergens like corn and soy. But then we get into the things that are universally bad, that these seed oils, they promote insulin resistance. Even though they don't trigger insulin per se. They fit into insulin receptors and kind of change the balance of that whole system. But maybe the worst part about the seed oils is that they are so harshly processed. They are superheated, they're produced under high pressure, and in order to get almost 100% of the fat out of those seeds and beans and grains, like corn is a grain, then they use solvents, because you can't just squeeze and get oil out of corn, you have to use solvents. And then with all this harsh processing, these oils get very, very toxic and very, very highly oxidized. They taste terrible. So now they have to bleach them and deodorize them and degum them and clean them up in all sorts of ways so that you could even tolerate the stuff. But all of these damaged molecules, all of that oxidative stress is still in the oil, and you're introducing that into your body. And this is probably the biggest reason why seed oils are so bad for you. But as if all that wasn't bad enough, seed oils are even going to check that last box because it's extremely high in omega-6 to omega-3 fatty acids. And that shifts the metabolic pathways, the inflammatory pathways in the body. So we're promoting the pro-inflammatory from that perspective as well. And number 2 on the list is trans fats. So what they do now, that's how they made margarines, that's how they make frying oils that will be more tolerant to heat, is they start off with a seed oil, but then they mess with it even more. Now they change the molecule further on purpose. They hydrogenate it, they saturate it. So again, all of the factors that relate to seed oil are now true for trans fats as well. But in addition to that, we've changed the molecule further, so now it does additional damage to your cell membranes and to the communication in the body. And now you're wondering what's going to top the list. How can you get any worse than checking all the boxes and then messing further with it as trans fats? Well, the answer is by combining virtually everything on the board, and it's called fast food. Because fast food is high in grains, it's high in corn and soy, it very often has lectins, often dairy. And then to top it off, virtually all of that food, even if it's not fried, they still use these seed oils, and if it's fried, that makes it even worse. And of course, they're very high in sugar. Alcohol is basically the only thing that you don't routinely find in fast food. So we're checking all the boxes, combining most of the worst of the entire board here. If you enjoyed this video, you're gonna love that one. And if you truly want to master health by understanding how the body really works, make sure you subscribe, hit that bell, and turn on all the notifications so you never miss a life-saving video.